Hi, everyone. I'm Sofia Gruskin, and I direct the USC Institute on Inequalities in Global Health. And I was a commissioner on the AIDS-Lancet Commission on Health and Human Rights, and I'm here to talk a little bit about that. And I guess what I would say, by way of background, is that the Universal Declaration of Human Rights, which has been in existence since 1948, is the global basis for a common understanding across countries of what are human rights. And the idea is to set an inspiring vision of a world that is just, equitable, and tolerant, and that can give insights and support the rights and health of the most vulnerable and marginalized population. And it should be a counterpoint to the atrocities, the repression, the horrible things that we are seeing these days. Now, for the past 30 years or so, health and human rights have come together in incredibly important ways, leading to so many important discoveries and changes. The global expansion of access to HIV treatment, broad expanses in ensuring the sexual and reproductive health and rights of lesbian, gay, transgender, and intersex individuals across the world, in minimizing the harms of war on civilian populations and caring for populations affected by war, and most recently in the global push to achieve universal health coverage. But I think, as we all know, recent times have shown significant pushback against human rights and against what it takes for there to really be healthy societies, with increasing impacts on the health and well-being of people everywhere in the world. And I say that noting that this is compounded when we think about all the new threats that are occurring. First, in terms of pandemics, COVID, obviously, but also all those that have and are following. You know, the COVID pandemic is a failed test of the world's commitment to solidarity and equity when it comes to health and well-being. You only have to look at the huge inequities in vaccine access that existed between countries to make the point on a global scale. But also within so many of our countries, the misuse of criminal law in attempting to regulate behaviors ostensibly in the name of COVID, with, of course, the most horrible impacts on folks already marginalized and discriminated against. But there's also climate change. I think something those of us living in Los Angeles see daily. Climate change is, let's face it, already having severe health and economic consequences in those communities and on those societies who are least responsible for what's happening with climate. And, you know, with vastly more serious disparities forecasted and very little being actually done about it. A lot of talk, not a lot of action. Now, alongside this, we see horrible rises in racism and xenophobia, and that's in all of our society, and let alone the repression of student activism that's happening on so many of our campuses in the United States these days. I could go on, but how does this relate to the Lancet Commission? Well, at the very start of the pandemic, Chris Barer and Adiba Kamuratzaman in 2021 formed the International AIDS Society-Lancet Commission on Health and Human Rights. And the idea was to put our heads together to begin to think about actionable recommendations we could make collectively to the horrors of all that's happening in the world. So the commission is made up of 23 commissioners, and it includes academics, but also health practitioners and civil society representatives, and we're from all regions of the world. And we have broad range of expertise to infectious disease, to mathematical modeling, to international human rights law, to history, to anthropology, you name it. But working together over the last few years, including monthly meetings on Zoom, a few in person, we really tried to reach consensus and to develop actionable recommendations in a number of areas that are at the intersection of health and human rights. But all of this was framed around the idea of invigorating the health and human rights movement and really seeing where our work could make a difference. So importantly, within the domains that we decided to cover, we recommended a more proactive approach rather than simply reacting to bad things that happen. But really thinking about those of us more in the public health world could take a leading role. So in terms of how we do our work, but also in terms of how we do training. The idea that in training, human rights should be mainstreamed in all that we do, including across the breadth of medical education, public health and education. It exists a little in different parts of the world, but if we're really going to make a difference, that really needs to be expanded. So I thought I'd offer a few snapshots about each of these domains in terms of why we thought this was important, the key issues, and also what we thought to be key recommendations. So no surprise, the first domain where we made recommendations is about pandemics, and thinking about human rights and equitable access to essential interventions. It's probably no surprise it's one of the domains. We're in an age of pandemics. And human rights principles can point towards an approach to be effective, equitable, and sustainable, with a focus on supporting people who are the most marginalized in each of our societies. So in terms of recommendations, first of all, in terms of this pandemic accord, the idea that WHO, the World Health Organization's member states, should endorse a pandemic accord that is grounded in human rights principles, something that now, as we do this, seems farther away than it did even just a few weeks ago. But it's something that we have to work towards. An accord that exists without attention to human rights isn't going to work. It's not going to make any difference. We also need investments. We need to be sure that everyone, no matter where they live, will have equal access to whatever diagnostics, vaccines, and treatment exist, that it's not based on where we live, but that we recognize international solidarity about how people can access this. And, the law was really misused in the context of the pandemic in all of our countries. And so we really need to ensure that criminal law is not misused again and isn't used to regulate behaviors through legal interventions, like what happened during COVID, in ways that are discriminatory and marginalize people unnecessarily. So, there's the pandemics, but then there's climate change. And I mentioned climate change at the very beginning. Climate change is not, it's not surprising that it's one of the issues we decided we needed to really address. And living in Los Angeles, we really do see the effects of climate change affecting every aspect of life. Posing threats to many of our species, to imperiling human health and livelihood. And really, you see this everywhere. So what we were recommending is that countries build momentum from COP27 to provide massive sustainable financing to enable truly effective climate change mitigation and adaptation. And this shouldn't be a shock, but that all public subsidies that deal with climate should be diverted to support a just transition away from the use of fossil fuels, and in particular, that action is needed to remedy the adverse effects of climate change on marginalized communities. And very, very specifically, that climate migrants should be afforded refugee status under international and national law, something that's just beginning. So in terms of health and human rights, in terms of displacement, migration, refugees, and conflict, well, probably it's pretty clear why this is a domain. And I mean that even before the horrors of what's happening now in Gaza. Now, in 2020, when we started our work, there were already an estimated 281 million international migrants, and the number of people migrating because of conflict in all parts of the world keeps increasing. And that obviously has huge impacts on their health and well-being, let alone on their accessing needed health services, and who is it that's supposed to provide those services. So we recommended that the United Nations and its member states strengthen the visibility and consistency of its leadership on both health and rights obligations in the context of war and conflict. And that means ensuring accountability by states when violations occur. Now, for those of us more on the health side, we have to be much more active in not just delivering services, but highlighting the health consequences of failing to protect the rights of people who are subjected to war and conflict. And so another domain we clearly thought was important was to address structural racism, inequity, and discrimination that exists against devalued or marginalized populations. And just to point out not only the rights aspects, but the health impacts of structural racism and discrimination. And I don't mean this only in terms of the United States, but in all parts of the world, this is really something we must all collectively address. So one thing we had agreement on is that countries that have been colonizers or engaged in other forms of economic abuse, they need to provide fiscal, technical, and other kinds of necessary support so that reparations can exist and that they can be meaningful. That those reparations, whether they're for historical or ongoing harms to the communities that have been harmed, are addressed. And for that to happen, we really need global and regional political bodies to proactively explore new mechanisms for translating international commitments on anti-discrimination into meaningful obligations that actually truly address structural racism. And we all need to be much better at addressing interacting forms of discrimination, how discrimination on the basis of racism intersects with discrimination, for example, on the basis of sex and or gender identity, just as a few examples, and how these compound on one another and ultimately impact people's health and well-being most seriously. And therefore the health community has to explicitly work to address racism and discrimination and all that it does, from public health interventions to really just the delivery of clinical care. Another domain, not surprisingly, was sexual and reproductive health and rights. Well, when you think about the regression in the last year or so in the United States around access to abortion or gender-affirming care, that obviously tells the story. But these regressions are really happening everywhere. And they really signal a move towards authoritarianism. Historically, we know interfering with bodily autonomy is part of anti-democratic agendas. So they're of concern in their own right, but also for what they signal to where the world is going if we're not careful moving forward. And so, here we explicitly wanted to call out that countries have to take immediate action to decrease enforcement of punitive laws and work towards decriminalization and removal of other burdens that, whether they relate to contraception, to abortion, to sex work, to sexual orientations, to gender identities, to basically put into place enabling legal environments so that people can flourish. Now, there were three new areas that we focused on that were new to us in this commission. One was around misinformation, disinformation, and therefore the right to accurate scientific information. The second was around artificial intelligence, and the third around the economic determinants of health. So first, in terms of misinformation. Well, we all saw during COVID the spread of health disinformation and misinformation on social media and beyond. And this is absolutely continuing, right? But we saw this alongside the empowerment of security services who could track and harass already persecuted populations, but in the name of public health. And the mobilization and there's really no other word for it, but the hatred that was put out there for purposes of violence and social exclusion. So clearly we said there was a call for the global community, and by that we meant international donors, multilateral bodies, national governments, private sector actors, and we looked at both high-income countries and low and middle-income countries, and the idea that we need to collaborate much more closely to close the global digital divide. And we have to establish mechanisms to monitor emerging technologies, those that facilitate disinformation. We've got to counter that through public education campaigns. And again, obviously here, the health community has a strong role to play in putting forward scientifically accurate information and combating disinformation. Now, in terms of artificial intelligence, why it became one of the domains. Artificial intelligence is advancing so quickly that regulatory measures just cannot keep up. Now, artificial intelligence has the potential, we all know, to bring major benefits to humanity, but it also poses major threats. And an essential first step, we believe, is to set out the implications of AI for health and for human rights, something that hasn't yet fully been done. So our recommendations are really first that this actually be studied, and that governments ensure that existing privacy legislation, regulation, and monitoring keeps pace with the advances in artificial intelligence, which just keeps moving so fast. And in order for this to be really effective, these measures have to be underpinned by a strong human rights framework. We need governments to work together with universities like USC and civil society organizations to raise awareness of the scope and nature of the different ways that AI is being used, with a focus both on how AI is helpful and harmful, not one or the other, but both, and therefore the implications of that for health and rights. Now, in terms of economic and commercial determinants of the right to health, we really decided that we had to look at this because, the highest attainable standard of health, something we all move towards, sad as it is to say, is strongly influenced by private multinational corporations. And they often operate free of meaningful regulatory oversight, and that impacts on access and use on so many products that are harmful to human health. So, our recommendations, clearly the country should strengthen their regulatory oversight of commercial interests, and they need to develop and enforce legal and policy frameworks. And at the same time, they need to implement taxes and other restrictions on tobacco, unhealthy beverages, and other health-harming products, but they need to focus also on the corporations themselves and to prevent the export of harmful products or commercial practices. And at the global, regional, national levels, as a commission, we called for the reduction of socioeconomic inequalities to be a primary focus of economic and social policy. So that's it. By centering these domains and setting out these recommendations, we hope to have set out an action plan of sorts that's relevant to anyone who cares about the health and human rights intersection, from civil society to governments to the UN. And for those of us in the United States, those of us at universities, at USC in particular, in terms of education, in terms of research, in terms of policy work, no matter what our discipline, the idea is to ensure that this intersection of health and rights isn't lost, but actually strengthened in ways that can be helpful to our work and to our collective actions to address injustice going forward.